Hi everyone. Uh, Today I am going to talk about an important anaerobic organism. Before going into the topic proper, just to have an idea about the case scenarios, how usually these infections would be present. The first one is a young boy met with road traffic accident and died of severe muscle necrosis and signs of shock and respiratory arrest. This is one case scenario in brief. Another is a group of students in a hostel had non-vegetarian dinner and suffered with abdominal pain and diarrhea. And another case scenario is a 48-year-old male admitted in a hospital 5 days back and now suffering with diarrheal disease. And a pregnant woman was asked by her gynecologist to receive TT vaccine. And another thing is a 2-year-old baby was fed with honey and admitted in a hospital with weak cry and severe muscle weakness. So, by seeing these different types of case scenarios in brief, uh, we can have an idea that one particular group of organisms may be responsible for this kind of infections. So that group of organisms which are responsible for all these kinds of infections and also the necessity for the vaccination would be discussed in a particular topic that would be in a Clostridium, the genus Clostridium. So in this particular three classes, consecutive three classes, I'll be talking on the genus Clostridium. So the learning objectives of this particular topic are: one is environment, how it either community or a hospital, how it acts as a source for this particular group of organisms. And another is what are the commercial uses of this Clostridial species. They not only produces the disease, they also used in commercially in certain industries. And what is the pathophysiology of all these Clostridial diseases would be discussed, and laboratory diagnosis of each Clostridial disease also would be discussed, because they produces the range of diseases like gas gangrene, food poisoning, tetanus, botulism, and antibiotic associated diarrhea. All these range of infections will be produced. How they have to be diagnosed, we have to learn. Next one is the treatment and the preventive aspects of Clostridial disease have to be discussed. And now we'll see what are the genus specific features of this particular particular genus. These organisms are the members of the genus are named so like Clostridium because of their swollen spindle appearance. As a cluster means a spindle like, and these are all gram positive and endospore forming anaerobes. And you can see on the right side the photograph shows the spores, endospores, which are seen in the form of bulges at the end, and many of them are saprophytes in soil, water and decaying matter, and some of them are proteolytic, some of them are saccharolytic. That means some of them can digest the proteins, some can produce the starch material, and they would be killed by autoclaving and chemicals like formalin. The formalin also effective in destroying this endospore forming bacteria. And medically important Clostridia are being divided into four groups. One is a gas gangrene group, number two is a tetanus group, and third one is food poisoning group, and fourth one is acute colitis or pseudomembranous colitis, or otherwise called antibiotic associated diarrhea. If you see the gas gangrene, the commonest agents causing for gas gangrene are Clostridium perfringens, Clostridium septicum, and Clostridium novae. And tetanus produced by Clostridium tetani, and the food poisoning produced by Clostridium perfringens. Of course, perfringens produces gas gangrene mainly. Apart from that, it also can produce food poisoning. And another important species, that is Clostridium botulinum, responsible for food poisoning disease. And acute colitis is produced by the Clostridium difficile. And the commercial uses of this Clostridium species, Clostridium botulinum used for the mass production of Botox, which is used in cosmetic surgery, and the Clostridium perfringens, which is a leavening agent. This leavening agent is used in the bakery industry. And next one is the Clostridium acetobutylicum and Clostridium butyricum. These two can be used for the production of acetone and butanol. And next one is the Clostridium butyricum. It's also used for the prophylaxis of and in the treatment of prophylaxis against antibiotic associated diarrhea. And Clostridium histolyticum, which will especially the collagenase enzyme produced by this Clostridium histolyticum is used for the debridement of infected wounds. And next one is the Clostridium zingale, and this is used for the production of ethanol from the carbon dioxide and hydrogen. So these are some of the Clostridium species used for the commercial purposes. And now if you see the Clostridium perfringens, this Clostridium perfringens morphology have been on right side with photograph and gram stain smear. They are large bacilli with truncated ends, and they are spore bearing rods and which are non-motile organisms. And source for this infection with this Clostridium perfringens is animal and human excreta and decaying vegetations and also the soil. All these acts as a source for these microorganisms. So coming contact with these kind of things are responsible for transmission of infection. Mode of transmission is Clostridium perfringens would be transmitted through food and also by means of traumatic implantation of this bacilli into the wound. And the predisposing factors for these infections are crush and severed injuries, especially in case of road traffic accidents. And while doing the surgeries also, the rough handling of the tissues also prone for the infection with this Clostridium perfringens. And another important conditions like debility, old age and diabetes mellitus also more prone for this Clostridium perfringens infection. Yeah, this varieties of toxins are produced by this bacterium Clostridium perfringens, and they are responsible for their pathogenicity. There are varieties of toxins and enzymes are produced by this bacterium like alpha, beta, epsilon, iota, and minor toxins like gamma, delta, lambda, kappa. You can see the range of different types of toxins produced. And another thing is the enterotoxin also can be produced. The last one you can see. And out of all these toxins produced by this bacterium, and most important thing is alpha toxin, which is more lethal because it has got the lecithinase property and also the hemolytic property, which requires the calcium ion for its maximum activity. So the alpha toxin, because of its lecithinase property, it can split the lecithin, and because of this property it acts like a most important virulence factor. And the next one is the enterotoxin. If you see the below one, that's enterotoxin. It is enterotoxic and cytotoxic, and so it's responsible for the gastrointestinal tract disease also in the form of diarrhea. And the varieties of diseases produced by Clostridium perfringens are the major toxin produced, that is alpha toxin, and this alpha toxin is responsible for gas gangrene and also the food poisoning. And next one is alpha, beta and epsilon. toxins, they produces dysentery in the lamb, and alpha and apart from alpha, even beta toxin also can produce enteritis necroticans in human beings. And in sheep also they can produce enterotoxemia and pulpy kidney disease. And in cattle also this alpha and iota toxins can produce the disease. And gangrenous appendicitis and necrotizing colitis is another important clinical manifestations produced in the sheep, cattle, and to some extent in human beings also by these Clostridium perfringens. Now we'll see the most important uh, pathogenic, most important disease produced by the Clostridium perfringens is gas gangrene, which is rapidly spreading edema. Apart from the myositis, that's inflammation of muscles, which includes the necrosis of tissues with abundant gas production and the profound toxemia, that's large quantities of toxins will be present in the blood. So in case of gas gangrene, you can see rapidly spreading edema and inflammation of muscles, necrosis of tissues, production of large quantities of gas, and large quantities of toxins would be present in the blood. And etiological agents, so to some extent already I mentioned, one is Clostridium perfringens, otherwise called Clostridium welchii. This is also called welchii. Next one is Clostridium septicum, and third one is Clostridium novae. These are the three important organisms responsible for gas gangrene. And this gas gangrene also produced by some other organisms like anaerobic streptococci and staphylococci, E. coli, and Proteus. So by means of culture, we have to differentiate whether it's produced by Clostridium species or the other than Clostridium species, because they whatever may be the causative agent, uh, the clinical manifestations resembles like the gas gangrene produced by the Clostridium species in case of anaerobic streptococci, staphylococci, E. coli, and Proteus also. Now we will see the pathogenic mechanism of gas gangrene. So followed by crushing or tearing or battle wounds, or followed by bullet injury, and that damaged tissue may be contaminated with soil, and in the soil if spores are present, and in the soil calcium ions and also the silicic acid also present. So the spores, calcium ions and silicic acid, all these followed by the tissue damage will enter, and they initiate the inflammation and tissue necrosis. And when the inflammation is in progress, the extravasation of blood and impaired tissue perfusion would be set in, which results in edema. And this extravasation of blood and impaired tissue perfusion and edema results in anoxia, that's lack of oxygen to the involved tissues. And this results in the existence of anaerobic conditions in involved tissues, and and that means redox potentials, and pH of the damaged tissues will fall down. And so when the pH is fall down, that's in acidic pH, the phagocytosis will get impaired, and once the phagocytosis gets impaired, results in germination of the spores which are already entered into the body to form the vegetative forms. And these vegetative forms is responsible for multiplication, and aerobic oxidation in tissues will be halted, and an anaerobic reduction of pyruvic acid to lactic acid leads to further fall in pH of the tissues. So these all in the production of large quantities of toxins by the multiplying bacteria, and this toxin results in the necrosis of tissues, which further leads to extravasation of hemoglobin and causes reduced oxygenation or oxygen carrying capacity, which results in further tissue damage. In other words, the toxin which is produced uh, responsible for the production of large quantities of gas due to the necrosis of tissues, and this gas which percolates into the layers of the involved tissue and results in crepitations, a typical sounds on pressure. And also this toxin is responsible for increased capillary permeability, which results in profound edema. So all these put together are responsible for profound toxemia and shock, and this toxemia and shock results in severe hypotension, and when the hypotension sets in, it results in multi-organ failure, and finally there is a possibility for coma and death of individuals if you won't treat the case properly in early stage of the disease. And the presentation of this particular gas gangrene, this presentation is gas gangrene presents in the form of acute inflammation with severe pain at the infected site, and tense tissue due to the edema and gas production, and on pressure you can see the crepitations. In this lower photographs you can see the wound status which is responsible for this gas gangrene, the blackness and all due to gangrenous formation. And right side also you can see the toes undergone for the gangrene formation, and above the toes, so that's on foot, dorsum of the foot, you can see the glistening surface, that is due to the severe edema and gas which gets accumulated below the skin. And these lesions will produce copious foul smelling exudates, and the person may have fever, tachycardia, increased heart rate, which is disproportionate to the fever for which the people are suffering, and people may have the pallor, this paleness of the skin, and rapid progression of this disease may lead to increased mortality. And another thing is the food poisoning produced by these organisms, that is the high risk foods are causing for food poisoning with Clostridium perfringens, mainly due to the contamination with the spores of this bacterium, especially the type of foods which are left at room temperature for a long time before serving. That means when the foods are prepared and before serving, if you leave them, that's more than 8 hours at room temperature, they may get contaminated with the Clostridium perfringens spores, and this spores gets germinated, and the germinated spores produces the vegetative forms, and these vegetative forms of the bacteria produces large quantities of toxins, and if these toxins are consumed by the consumer, then it may lead to the food poisoning. So the areas where you can see the common food poisoning with Clostridium perfringens are institutions, school cafeterias, prisons, and in nursing homes. That means where the people will be crowded more, these are the possibilities. And the common varieties of foods associated with food poisoning with Clostridium perfringens are meat dishes and casseroles prepared with chicken, beef, or fish, and which are left at room temperature for more than 8 hours, are the very dangerous foods. So these foods, once contaminated with bacteria, they produce a heat labile toxin, that is enterotoxin, and this toxin is heat labile, that means heat sensitive. So if you again cook the food at minimum 75 degrees centigrade for 15 to 20 minutes, or at 100 degrees centigrade for about 3 to 5 minutes, then this enterotoxin gets destroyed. And symptoms which we can see here are the symptoms will appear 6 to 18 hours, that's very short onset, and people may suffer with abdominal cramps, diarrhea, but there won't be a fever and vomiting. So only the diarrhea will be there, no fever and no vomiting. This is the major difference between the staphylococcal food poisoning and this food poisoning. Here you can see only diarrhea. In case of staphylococcal food poisoning, the duration or the incubation period is same, around 6 hours, but there will be vomitings apart from the diarrhea. But here, in case of Clostridium perfringens food poisoning, you can't see the vomitings, only diarrhea will be there. Usually it's a self-limiting disease, and the person will come to the normal state within 24 hours after the onset of the clinical manifestations. So usually to say it's a self-limiting disease. On the right side you can see the type of dishes which are responsible for this kind of food poisoning. And lab diagnosis, this Clostridium perfringens infections, most of the times we can diagnose these conditions based on the clinical appearance. The edematous, crepitative skin areas at the site, at the wound site, we can say that it would be a case of gas gangrene. And the necrosis you can see, crepitations you can see, and the exudates or the necrotic tissues has to be collected from the deeper parts of the infected wound site, and then by means of culture we have to isolate the bacteria, and we have to perform the toxicity tests on that, and then we have to confirm their pathogenicity. And stool, the enterotoxin can be detected by using the ELISA method in case of diarrheal disease. And next, cultural characteristics. This is an anaerobe, as I mentioned already, and they can grow at the pH range of 5.5 to 8, and the temperature range around 20 to 50 degrees centigrade. But optimum temperature is not the 35 degrees centigrade like any other bacteria. It's around 45 degrees centigrade. And on egg yolk medium or RCM broth, we can grow these organisms. On meat, on RCM broth, in RCM broth, the meat particles will be converted into pink, and there won't be any spores will be formed in the culture. But when the organisms are present in the soil, you can see the spores, but the spores will not be seen if you grow these organisms in the culture medium. And if you grow these organisms on the blood agar, they will show a typical hemolysis, that is target hemolysis. The target hemolysis means, you can see on the right side, the below photograph, if you see around the colony, you can see the clear zone of or narrow zone of complete hemolysis you can see, and around that you can see the wider zone of incomplete hemolysis. Wider zone of complete hemolysis, or in the first photograph, the above photograph also, if you see that a streak line across across the plate, the streaking of this growth has been done, and nearer to that you can see the clear zone of hemolysis, and just below or nearly 1 centimeter below you can see again a hazy zone of hemolysis, which is called incomplete zone of hemolysis, and this is known as target hemolysis. This is a typical of Clostridium perfringens. And then the confirmatory test is by demonstrating the Starmy fermentation. So how to demonstrate this Starmy fermentation? One is, we have to take the litmus milk. For that we have to add the pure growth and cover that particular mixture with a paraffin. And if you allow it for fermentation, on fermentation the lactose which is present in the milk would be fermented and produces acid and gas. And this acid which is produced by the fermentation of lactose acts on the casein, and which is present again in the milk and cause for the coagulation of the casein. And here the casein, now the coagulated casein is present in the test tube, apart from the gas which is being produced. So the gas which is produced is enormous in quantity by these organisms. So when this gas is trying to come out, it pushes the paraffin plug up and clots are seen on sides of the tube. Just like if you put a stone in the mud, how it been seen upwards. In the same way, you can see here also. And this type of fermentation is stormy fermentation. That means the gas will be rushed into the environment through the paraffin plug from the coagulated casein. So it's known as stormy fermentation. Not only this lactose, it can ferment the glucose and sucrose also with production of acid and gas. And these organisms are indole, and the Vox-Pascal's test are negative. AMR test also negative, and hydrogen sulfide production and nitrate reduction tests are positive by these organisms. And another confirmatory test is demonstration of toxicity of alpha toxin. So here, I already mentioned that this alpha toxin has got an important property, that is lecithinase property. So to demonstrate the lecithinase property of alpha toxin, we have to do a simple test. It's not simple, of course. It's a but rapid. Within 12 hours, we can see the results. So to do this particular test, that is Naegele's test or Naegele's reaction, we have to take the Field's peptic digest agar, which consists of 5% Field's peptic digest and sheep blood and 6% agar, egg yolk and neomycin sulfate as a selective agent. So this plate on right side, if you see, it has to be divided into two halves. One half of the plate has to be incorporated with antitoxin, and the next half of the plate has to be left like that. And on this plate, we have to inoculate the pure growth of Clostridium perfringens. The two streaks on across the plate, what you can see are nothing but growths of the Clostridium perfringens. So if you see on left side of the plate where antitoxin is present, you can't see any kind of opacity around the growth, which you can see on right side of the plate. On right side of the plate, around the growth, you can see frank opacity. And this opacity is due to the toxin which is produced by this bacteria acts on the lecithin which is present in the egg yolk of this medium and responsible for precipitation or the white color appearance. But on left side of the plate where antitoxin is there, this because of the action of the antitoxin, the toxin was alpha toxin was neutralized. So lecithin will not be split out by the alpha toxin, and so you can't see any kind of opacity around the colonies. So based on this test, we can demonstrate the action of alpha toxin, which is major toxin responsible for gas gangrene. And treatment for gas gangrene, the early surgical debridement has to be the most important thing, and wound should not be closed immediately because it provides anaerobic conditions. So you should not close the wound. It should be kept open. And clindamycin and penicillin has to be given for 14 days. And hyperbaric oxygen, of course, no use for the aerotolerant Clostridia like Clostridium septicum, which are also responsible for the Clostridium perfringens. It can cause for this gas gangrene, but if you treat the individual with this, there won't be any use. That's why there is a question mark. And anti-alpha toxin serum has got a great role. So this anti-serum is available in the market. So at the time of peak level of the disease, we can save the person by giving this antitoxin, which is most important, which plays a most important role in the treatment of acute case of gas gangrene. So the take-home message, as far as this thing is about the first photograph is, while you are taking food, the healthy meal of French fries with extra salt, and so we will get what we call excited with the foods. But before taking the foods outside, be careful about this kind of Clostridium perfringens infections. So this is about Clostridium perfringens. Happy learning. Thank you very much.